Jennifer Gardy from the BC Centre for Disease Control. I'm a former systems immunologist in a previous life as a postdoc. I really appreciated your comments on social networks and their influence on personalized medicine. And I was wondering, we know that information travels in networks, and you highlighted that as one of the components of patient education. But we also know that misinformation travels in networks, and certain social contagions do things like cigarette smoking and obesity are all behaviors that do have clustering when we look at the social networks. So how, with P4 medicine, the diagnostic and the therapeutic implications are quite clear, but what about the social implications and having people change their network if that's part of the problem?
Well, I think that's really a good question. Myself, I haven't gotten very involved in any of the network things. And part of my objection is just the signal to noise is horrendously in favor of the noise. But with kids, that's not a problem. They're willing to tolerate that kind of thing. So I think one of the really important roles of physicians in this new world is to be able to use their judgment and their knowledge to tell the patients that they're really off base, that this crackpot idea that you can cure cancer with Laetrile just is not so. I think that's going to be a really important role, and maybe there'll be a lot of counselors that will do these kinds of things as well. So I think you have to have a check and balance, that is, someplace responsible patients can go and find out whether these ideas are really true or not. But again, I think it's going to be the patients that's really going to drive and expand the possibilities.
My question is maybe related to the last one, but it is, and I think it certainly relates to your participatory aspect to P4 medicine. But so much of ill health or lack of health now is based on poor lifestyle choices.
Right.
So whether it be cigarette smoking, which unfortunately is very much on the decline, but obesity very much on the rise. How do you envision, in this new paradigm, have individuals having more information about their genetic makeup, their proteomic makeup? How is that going to make them have the force of will when asked by the waitress, do you want fries with that or salad, to choose salad?
Well, that's a good question. I think the most, in talking with my friend Larry Smarr, he said what really changed his bad habits was that longitudinal information he got every day. He could eat the big meal, the big steak, and a day or two later he'd see his cholesterol had shot up 80 points and things. So I think having information and giving you the feedback on what you're doing to yourself is going to make an enormous important role. What is one of the most effective tools for weight losing? It's a scale. If you get on the scale and you look and you gain 5 pounds, you say, oh my God, I've got to get back to where I was before. But suppose that you have 10,000 really interesting parameters that you can analyze in that way. So I think that's going to be what can change. Now, will it change all people? Who knows? But it'll change a lot of people.
I think another trend that's coming up is that with the younger generation that are spending more and more of their lives online. And even this concept of having a second person or multiple personalities, if you will, online, where perhaps your physical self will start to become even less relevant.
Yeah. Well, I think the other approach too, and some people will object to this, I think insurance companies should charge you if you abuse yourself. Just, and they do now. Some people, you have to pay more to smoke or things like that, but I think we ought to make that. Look, society is paying for you to be healthy, so you don't have a right to run up the bill. So I think we have to be able to deal with that. And financial things are a good motivation for changing people.
Sorry, we're gonna have 2 more questions, and just the last 2 people, and then other people are gonna have to catch Dr. Hood in the hallway. So.
I'm Stacey Jones. I'm a research assistant at Simon Fraser University. My question is more on, you've talked a lot about the P4 approach to health, and you were mostly applying it to, at least at this stage, richer countries, first world countries. How can we develop that to work in where diseases are much more prevalent in third world countries, in countries where they have the basic issues of clean water and just disease rampant? How can we use P4 and develop it so it's not so rich, I guess?
Yeah. Well, I would say two things. One, if they don't have clean water and some of those fundamental things, we ought to start with those first. I mean, I think P4 medicine comes after you get clean water and everything. My own conviction for a lot of different reasons is that P4 medicine, as I've said, is going to turn these ever-escalating costs around. And I think it'll drop into the point we can really think about exporting P4 medicine to the developing world. And as I said, democratizing healthcare in a way that was inconceivable before. And that, I think, is, and let me give you an example of where something similar occurred. So who would have ever guessed in 1990 that a woman in a rural village in India could make a living for her family using the digitalized cell phone? That happens now. And that's what digitalization has done, and that's what the digitalization of medicine, the change in cost is going to do in a very similar way. And the infrastructure that we create for implementing this kind of thing, I mean, all of those things have to be worked out. But I think there will be the opportunity, just as there was the opportunity in communications and to a certain extent in education.
Great, thank you.
Mm-hmm.
Hi, I'm Mark McClough. I'm a patent lawyer at Smart Bigger here in Vancouver, and I have a plant background, so I immediately think of large populations. So I was wondering, and you've been talking about P4 medicine and individual human drivers, but I wondered if you had any comments about how this is going to feedback and what implications it's going to have for epidemiology.
On epidemiology, you said?
Yeah.
Well, I think we're going to be able to analyze the individuals so inexpensively and so easily that epidemiology will be the analysis of the quantized units of the populations you're thinking about, basically. It's really where we are. One of the big revolutions I didn't talk about that's coming in science is our ability to analyze single cells and to determine say in cancer, the role that different discrete quantized populations of cells play. And I think with a lot of epidemiology, we'll have these sensors that will be very, very easy to slap on someone who'll be able to record data from people. So we'll be able to, I think we'll be able to quantize the epidemiology into its individual units of function, basically the individual human beings. Okay, thank you very much.